Good evening, everyone, and thank you for being here today. My name is Gabby de Jesus. I'm with Florida Voices for Health, and today we're here to discuss healthcare in rural Florida, the status and report and the resources available to those in rural communities. The goal of this event is to explore the current situation and historical difficulties faced by rural communities in Florida, but also to hear a little more about the impacts of COVID-19 on these rural communities. We're going to explore the available resources for those living in rural communities, as well as the policy changes needed to move further to improve the lives of Floridians in rural areas. Now, we're going to hear from one of our beautiful Floridians a story about how rural health has affected their life.
I've been a stay-at-home mom the past year, taking care of my newborn daughter, and I don't have health insurance. My partner and I recently moved to Florida from Ohio. He has insurance through his job, but because we're not married, I can't be on his health insurance. Before I had our child, I worked full-time and had insurance through my employer. If I'd gone back to work right away, my entire paycheck would have gone to daycare. So I stayed home. Our daughter is a little older now, so I've been looking for work. It's been very difficult, even though I have an excellent job record. I've been able to find some part-time work, but they don't offer benefits to part-time workers. In Ohio, as a stay-at-home mom, I had full Medicaid coverage. What's crazy is that my partner made twice as much money in Ohio as he does here in Florida. We still qualify for Medicaid. When I applied for Florida Medicaid, they gave me the share of cost Medicaid. I would have had to pay over $2,000 a month out of pocket before Medicaid would step in. That's unreasonable for my family. We are behind on our rent and struggle to take care of our basic needs. I've been suffering from postpartum depression and anxiety. I went to my local mental health clinic, but we didn't qualify for help on their sliding scale because of being in the Medicaid share of cost program. So my copay for services was going to be $175. I called and canceled the share of cost Medicaid just so that I could qualify for the clinic's sliding scale program. It sounds ridiculous to me that having any coverage would actually prevent me from getting care. Once I canceled, I was able to get in on the sliding scale and now pay $3 as a copay to see a doctor. I recently went to my county health department and saw a nurse because I wasn't feeling well. She ordered blood work and it came back that I have a hyperactive thyroid. The health department and rural health clinic told me that they didn't feel comfortable treating me without a consult from an endocrinologist. There are no endocrinologists in Baker County where I live, so I had to go over to Jacksonville and Duval County. My county health department and the clinic sent letters out to various specialists to see if they would treat me, given that I don't have insurance. Well, I heard back from one doctor. He's booked out so far that I can't be seen for 3 months. In addition, they couldn't tell me how much it would cost. The range is between $45 and $200. Since it's a few months out, I can spend some time setting some money aside. So I guess it's a good thing that I have to wait. While I was waiting to hear back from specialists, I took it upon myself to personally call every endocrinologist in Jacksonville. I literally called every one of them that came up on a Google search, and not one was willing to work with me. Some didn't take patients without insurance, while others required a large deposit before they would see me. The Mayo Clinic was like that. They required a $5,000 deposit before they would even schedule an appointment with someone without insurance. One doctor's office hung up on me as soon as I said that I was uninsured. I feel like I'm being punished extra for being in a rural community. If I were just poor and uninsured, living in Jacksonville or Duval County, I could get the treatment that I needed. I've been struggling with exhaustion, have trouble sleeping, have panic attacks and anxiety. Hyperthyroidism affects your metabolism as well, so I'm always hungry. But because I'm poor, I can't afford to feed myself adequately. I was turned down for food assistance, but have recently reapplied. This is all really overwhelming.
In today's roundtable discussion, I'd like to introduce our awesome guest today, We have Joseph Benton from Rural Health Partnership of North Central Florida, Jeff Feller from WellFlorida Council, and Anne Swerlick from Florida Policy Institute. I'd like to introduce you all and give you a moment to also introduce yourself. If you could please briefly discuss what your organizations have been doing, as well as your names and titles. Joseph, would you like to start?
Yeah, absolutely. So my name is Joseph Benton. I'm normally the executive director at Acorn Dental Clinic in Brooklyn, Florida. I also serve on the Rural Health Partnership under the excellent leadership of Jeff Feller here. And the Rural Health Partnership is fiscally managed by WellFlorida, and the idea is there to help coordinate rural healthcare delivery systems. So that's kind of what the general idea is, I guess.
Please, Jeff, could you please introduce yourself and your organization?
Thank you, Gabby. My name's Jeff Feller. I am the CEO of WellFlorida Council. WellFlorida is one of the state's 11 statutorily mandated local health councils. Though we are all in statute, we are nonprofits. WellFlorida is designated to serve a 16-county region from Hamilton County at the border down south, down 75 till about Hernando, Lake County area. We have about 12,000 square miles and 1.7 million residents within that region we serve. So that evens out to a predominantly rural area. We do some grants and serve some things, may have some services on our own, but one of our primary focuses is to do community health assessments and community health improvement planning, predominantly in these rural communities, to help give them the insights and the tools needed to make policy and programmatic changes for the benefit of their residents in terms of health outcomes and health access.
Thank you, Jeff. So I see that you all have very diverse perspectives and backgrounds, which is great for the conversation. And one of the things that I'd like to ask you today is what trends have you seen amongst rural populations when it comes to specific conditions and overall health status? Anyone can volunteer to start.
Well, I guess I'll go quickly here. So probably one of the largest trends that we see right now with rural populations is a lack of health access. I mean, I think one of the things that Jeff will probably talk about later, will touch on, is that we've lost some facilities in the last several months, whether it be a FQHC, whether it be a primary care provider. We're trending in the wrong direction. We know that the national average, we have tons of people in rural areas all over the country, and in Florida, North Florida specifically, is one of the worst parts of the entire U.S. And we're trending in a direction that is providing less healthcare to those populations. So, and specifically to something that is close to my heart is dental care, and dental care is almost even worse than normal healthcare. So in terms of access for rural residents, so we're going in a direction. Probably COVID-19 has exacerbated the issue. I'm sure Jeff and Ann would agree with that. But we were probably not trending in the right direction beforehand.
Thank you, Joseph. Jeff, would you like to add anything to Joseph's words?
Well, and Joseph mentioned sort of an access issue. I would go back to the disease states that we're seeing. In 2019, the CDC released a report comparing sort of urban and rural health outcomes, and they really focused on the fact that heart disease, cancer, unintentional injury, including substance abuse, chronic lower respiratory disease, and stroke account for 61% of the deaths in the country. However, in rural communities, we're leaps and bounds in terms of magnitude in all 5 of those areas in terms of poor health outcomes. So what we're doing, and a lot of things we're doing at WellFlorida and with the Rural Health Partnership, are focusing in those specific 5 disease areas. And I should add that in unintentional injury, that also includes substance abuse, so that, which is a big issue. But right now, those are sort of the 5 health outcomes that are really driving a lot of the work we're doing.
Thank you, Jeff. Anne, would you like to add to Joseph and Jeff's words?
Well, just to echo the coverage issue, that we are trending backwards, and I think I'm going to speak a little bit more about that. But Florida has one of the highest uninsured rates in the country, and rural counties are disproportionately impacted by that.
Thank you, Anne. And knowing that the situation has been like this prior to COVID, how has COVID impacted these communities? I mean, I'm sure that it has potentially exacerbated all the issues faced in rural communities, but is there anything in particular that you all can talk to me about?
Gabby, would you mind if I take the first stab?
Absolutely, Jeff.
In prepping for this, I think we've had some discussions, and one of the things, and I sort of made a warning to us as a group that I didn't personally want to focus on COVID and the pandemic per se, because when we start having that discussion, all other issues, whether it's rural health, economy, whatever you're talking about, gets subjugated to COVID. But I will say one thing, and it's not really about the health issues or the health. It is more of health access, not the health issues I talked about. But the thing we're finding is the pandemic, and I use this term, is just one more tectonic plate putting immense pressure on the rural health outcomes and rural health access of the residents in rural communities. So it's not really sort of revealing some new problem. It's just adding that much more pressure to a community, to a sector of our society that doesn't have good health outcomes and doesn't have the same access as its urban and suburban brothers and sisters. And the one thing that I wanted to point out is it's not really healthcare related, is that through this pandemic, we've all heard about how different organizations, and I'm sure Ann might talk about this in a minute in terms of the Medicaid and Medicare and some of the third-party insurers, but there's been a widespread embrace of telehealth among providers. There's been more of an impetus for our funders and our payers to embrace allowing telehealth, and we're sort of moving quickly in terms of adoption and patient acceptance to telehealth at a speed that we've not experienced in the last decade, though the promise of telehealth has been out there. However, what this has uncovered is the dramatic digital divide we have in our rural communities, because in order for telehealth to be effective, we have to have a robust and fully accessible broadband connection for our rural communities. And I won't belabor it much more, but just yesterday, the Washington Post did a major story on this in the education context, but their lessons there about the difficulty with broadband is equally valid for healthcare. And until we solve the broadband issue that has been increasingly revealed during the pandemic, then telehealth and the promises of telehealth and the access that's going to give rural communities in the future is going to be a false promise.
Yeah, if I could just tag on to what Jeff said there at the very end, the telehealth specifically, I'll give you an example from our dental clinic in Acorn. We had, of course, you all know I was a little bit late getting on because of a poor internet connection, and that's exactly why that we could not go forward with telehealth. Whenever we looked into it, the internet access availability here is horrible, and we're able to pay for the best service that we can get, but all of our clientele, of course, are lower in terms of socioeconomic, and they're not able to cover those costs to get the best internet available. And in addition to what Jeff said, you also have to have a phone capable that has a camera good enough that you can actually see what's going on. So not everyone has a smartphone, believe it or not. So that's another angle that the patient has to have this equipment and the ability to call in and get a video connection in order for telehealth to work properly.
Thank you, Joseph. And I'd like to ask you a little more about the rates of uninsured in Florida and in rural communities specifically. How do they compare with demographics in other parts of the state?
Well, first, if I could take a step back and just review, why is it important that people have health insurance? And there's overwhelming research and studies now that demonstrate that people who have coverage are much more likely to get preventive care and as well as services for major health conditions and chronic diseases. And when uninsured people have to seek care, they're much more likely to be saddled with medical bills that they're unable to pay. We know for children that there's some special considerations. There's research showing a correlation between children having coverage, doing well in school, and growing up to be independent, economic, self-sufficient adults. So coverage for kids has a lot of impact as far as having a capable, thriving workforce in Florida. Now, looking at uninsured numbers in Florida, first, a caveat, these numbers that have been compiled that I'll talk about, they're pre-pandemic. So it's much more likely that because of massive job losses and loss of employer-based health coverage, that the numbers are even worse. But pre-pandemic, Florida had 2.7 million uninsured people. This included 343,000 children. Notably from 2016 to 2019, there were 55,000 more children in Florida that lost coverage. That's according to a study that just came out last week from Georgetown. And our uninsured rates are very high compared to the rest of the country. We're ranked 46th in the country, and for years we've had very low ranking on this factor. The national average is 9.2%, and we're at 13.2%. For adults, and we'll talk more about this later, but a significant factor is that our state has chosen not to expand its Medicaid program. We're just one of 12 states that have chosen not to do so. That means a lot of adults, non-elderly adults, are left out of the Medicaid program, and we've got even higher rates of uninsured for adults, non-elderly adults. Almost a quarter of non-elderly adults in Florida are uninsured. And in many rural counties, those percentages are even higher. For example, when I was just glancing at some of these statistics yesterday, Glades and Monroe County are around 34% are uninsured, Hendry County, 32%. Now, for children, the statewide uninsured rate is significantly lower. And I don't want to overwhelm you with too many percentages and numbers, but our rate is 7.6%, but we're still way above the national average of 5.7%. And we have the worst child uninsured rates in the South. Our neighbor, we can look to Alabama, has a rate of just 3.4%. And again, in multiple rural counties, the uninsured rates for children are even higher. Now, to be fair, I did want to point out, there are some rural counties that are doing better in terms of their residents getting coverage. And why is that? I don't know for sure. I haven't seen any recent research on that, but, and I'm sure our other speakers have some perspectives on that. But some possible variables we need to consider as we go forward trying to figure out solutions is, one is that in some of these counties, there's a disproportionate number of Latinx families. And because of recent changes at the federal level around immigration policy, we're hearing that many families are very fearful about trying to apply for Medicaid for themselves and their children because they're extremely afraid of the implications for them being able to remain in the country. And one other factor that I think is very important in rural counties as far as coverage is we have in recent years, both at the federal and the state level, severely cut back on resources for education of families and outreach to them so they know what public insurance options are available and to help people navigate through the maze of getting enrolled. So I'll pause there.
Thank you. And just to add to your comments, I agree that at a federal level, the situation with immigration status has been very complicated fact given to its national impact. And so was the case in Colorado too, when I did my research there. So Joseph and Jeff, I want to talk to you a little more about the closure of rural hospitals. We know that in the past few years, several rural hospitals have closed, limiting access to medical attention to many of these people in these areas. Could you tell us how it has impacted the people in rural areas and what resources are available to these people?
Joseph, if you don't mind, I'll take the
Sure.
flush at that one. Excuse me. It's not even over the last few years. Since the pandemic started, there I go bringing the pandemic in again. WellFlorida's region, or the Rural Health Partnerships region, has lost 3 hospitals, 2 federally designated critical access hospitals, and 1 rural hospital. Now, that loss of acute care hospital services in and of itself is just a crushing blow to those communities. But what many folks, and I'm sure many of the other communities in Florida and around the country are understanding and learning when these facilities shut down. 2 of our 3 hospitals were not only hospitals, but they were also rural health centers designated by the federal government, which means they were primary care facilities, primary care homes for those rural communities. And in these communities, especially the 2 I'm talking about that had the critical access hospitals that were rural health centers, a substantial number of rural residents receive their not only acute care hospital situation care there, but their regular ongoing primary care home type services there. And they not only lost the acute care services, but have lost those primary care homes as well. Again, further exacerbating and probably making it much more likely that adverse health outcomes are going to be on the rise in those communities.
Yeah, and just kind of picking up where Jeff left off, one of the problems that comes as a result of that is whenever you have these places close, then that means that you have some patients that don't know where, or maybe they can't receive care, and that means that there's an increase in ER visits. And whenever you have an increase in ER visits, the state ends up footing the bill if someone doesn't have insurance. The average cost for an ER visit in 2018 in the state of Florida was over $7,000. So that adds up extremely quickly. One of the things that when we closed down the Acorn Clinic, we screened. Part of our screening process was asking if they had to make a trip to the emergency room. Several of our patients, I think over 60 of our patients, said that they at some point during the COVID closure had to go to the ER visit. Now, specifically for dentistry, if you go to the ER with a toothache, you get a painkiller and an antibiotic. So the problem is not even solved. So you have this giant sum of money from the ERs. If that was somehow reinvested into rural health clinics, then we'd be doing great. But that money's lost every year whenever these places close. It's that price is going to continue to go up.
I will say about the ER situation, just to add, that's if you have the luxury of being proximal to an ER family in the rural community that may not have transportation.
Right.
A lot of these folks won't even make it to the ER until it's so critical that they can basically get EMS to transport them 45, 50, 60 miles away to the closest hospital.
Wow. Do we know the areas that have been affected by the hospital closures?
Well, we have Shands Live Oak that shut down in Live Oak and Suwannee County. We have Shands Stark in Bradford County. And then we also had just recently, and this wasn't a rural health center, they still have one other hospital in the community, but it was Lakeshore Medical Center, Shands Lakeshore Medical Center, which was the primary indigent and charity care hospital in the community. The other hospital, a great hospital, being predominantly a for-profit facility on the very western edge of the community, outside the sort of the poor side of town, so to speak.
And let me ask you, do you know of any resources available now to the residents of these areas close to the where the hospital used to be?
Well, we still have in those communities a good network of federally qualified health centers, and there's still other private practices and group practices that are designated as rural health centers. So a lot of those facilities, because FQHCs are federally funded, they're sliding fee, they have to take all payers. Same kind of concept with the rural health centers. They get enhanced reimbursement for Medicaid and Medicare in order to take the charity or the vulnerable populations. However, what's occurred, even though we do have maybe even an ample supply of those clinics in those communities with capacity, they're located again in areas that are probably now more distant from where people can transport and get to them easily. So there might still be capacity that could absorb those patients, but that capacity can't necessarily overcome the transportation disadvantage of those clients that have been left behind.
That makes sense. Thank you, Jeff. And I'd like to ask you, do you know of any solutions that currently exist to protect or strengthen the standing of rural hospitals currently in Florida?
Yes, and I mean, it's sort of stating the obvious that rural hospitals are going to be greatly benefited if more of their patients have health insurance coverage. Otherwise, they're having to deal with uncompensated care, which ends up costing everybody money. And so I'm circling back to something I touched on before, and that's Medicaid expansion. Since the pandemic, the numbers of non-elderly adults that have become uninsured, we know have grown. And it's projected that we now, throughout the state, we'd have 1.5 million uninsured Floridians, non-elderly, who could get coverage if we expanded our program up to 138% of poverty. So how would this impact rural hospitals? Well, first of all, we need to say that that some of the states have had Medicaid expansion in effect through 2014, and there have been more and more coming on board. So we now have 39 states, including DC. And so there's literally hundreds of studies now that are documenting the health and economic benefits of expansion. And with regard to hospitals, the studies are demonstrating that Medicaid expansion has significantly improved hospitals' operating margins and financial performances, and significantly reduced the probability of hospital closures, especially in rural areas. Let me say a word about getting more people on Medicaid. Medicaid, as you've heard from our other speakers, transportation is just a huge problem for people in rural county trying to get to medical appointments. And Medicaid actually offers a transportation benefit that will help people get to appointments. And this is not something, typically offered under private insurance plans. And a lot of times it's kind of regarded as like, why are we providing this kind of extra benefit that nobody else gets? Well, it's because Medicaid is specifically tailored to people who are low income, and transportation expenses can be something that is just not within their reach. People don't have cars, they can't afford gas. So another particular benefit of getting more people access to Medicaid coverage would be this transportation benefit.
Thank you, Anne. Jeff, would you like to add to Anne's words?
Excuse me, what was that, Gabby?
If you'd like to add to the question, it was what solutions exist to protect or strengthen rural hospitals?
Well, I would totally agree with Ann on the Medicaid expansion and getting coverage, getting people covered, because that gives a compensation source. From a community perspective, piggybacking on the work Joseph and I are doing on with the Rural Health Partnership. And again, this isn't directly the hospital, but it's the hospitals working together with the other communities. One thing that's just available now, and again, it's going to be limited, it's going to be very competitive, but HRSA, the Health Resources Services Administration, they have a rural healthcare services outreach program where networks of hospitals and providers come together. But this year was the first time ever they've done a couple things, and I'm encouraging communities to come together throughout Florida, especially the rural communities, to consider this grant. It's due in December. First off, they've expanded the years you can get the grants to bolster your network from 3 to 4 years. And they've also created another grant program underneath the Rural Health Care Services Outreach Grant called the, let me see if I can remember, the Healthy Rural Hometown Initiative, which also not only increases the annual grant from 200 to 250, 150,000 a year, but also has a whole bunch of different incentives for having the hospital systems work together with the providers on population health initiatives. So clearly the most immediate infusion would be if we can get compensation sources for the clients that don't have compensation, health insurance, public programs, things of that nature. But a longer term initiative would be to take advantage as communities, as rural communities, of these rural health outreach grants. And these are like of a 30-year history of being awarded, even in difficult economic times. It is one of the investments that our country is been wise to make on an ongoing basis.
Thank you, Jeff. Now, this question is for all of you since you all come from different backgrounds. It's important to know, based on your perspectives, how have these healthcare issues impacted other areas of people's lives? And what role do other social determinants play in these outcomes?
You want me to take that one first?
Sure, absolutely. Go ahead, Joseph.
So I think specifically, I wanted to go back to something that Anne was talking about earlier in terms of the children and highlight something there. Back in some from records in 2016 of eligible Medicaid and CHIP patients. This is for children alone. In our county, there were only 37.8% of children received any care at all. So we're talking about, essentially 63% almost of kids that did receive some, but 37%. And if you extrapolate that out to children that are eligible in the Nitro County, that's almost 16,000 children alone. So the problem is wide spanning. And going back and echoing or I guess re-emphasizing what Anne was saying about Medicaid expansion or Medicare expansion, Medicaid. If we're able to expand that and get closer to healthcare for all or offering healthcare for all, that's going to solve a number of our issues.
Thank you, Joseph. Who would like to go next?
Yeah.
Well, I'll just make a pitch for oral health, which you all know all about. But I was formerly a legal aid attorney, and so I worked on the front lines with a lot of folks that were uninsured, and some of them just had terrible oral health problems, where and of course some of them were elderly as well, and Medicare doesn't really cover that. But what I saw that has just a huge impact on people psychologically. If there's, to say it's a cosmetic issue is to minimize it, because it really has all kinds of severe health consequences. But it also impacted on people's ability to get work. We had people that were very convinced that they were having trouble getting, for example, a job at fast food because, the owners, employers would, they may not say it, but they would make judgments about how the person appeared. So, I mean, that's just one example of how not being able to access oral health can make a lifelong impact on people's quality of life and ability to support themselves.
I hadn't thought about that because I grew up in Dominican Republic, and to us dental health is primary. It's important, just as going to the doctor. Like the mouth is so close to the brain that anything can easily affect or harm our body. So I absolutely agree with.
Well, and also that in the United States, and I'm glad you brought that up, because pretty much everything from the chin down is what's covered, right? And so mental illness and oral health, are we kind of look at as secondary for some reason. So what Ann said is absolutely spot on. I mean, 90% of the people that we come in, we're pulling 14 teeth out of 15-year-old kids. Okay, so I mean, it's extremely sad and unfortunate that we've gotten to this point.
Jeff,
Sounds like
like
Joseph's an advocate initiative.
Yeah.
Jeff, would you like to add to any other issues that?
I don't know if we have some more questions coming after this one. I may have some things to add there generally, but in terms of health determinants and health in general, the impact of that. Look, if you don't have good health or you're constantly under pressure worrying about your health, you're not going to do your best job. You're not going to give your best effort in the classroom. You're not going to be the best spouse or partner you can be. You're not going to be the best citizen you can be. You're not going to be the best volunteer. And as long as we have tremendous amount of individuals in this society that cannot and do not have the same benefits or the ability to share in the health benefits that many of us do, that means collectively our economy is going to suffer, our educational systems are going to suffer, our faith systems are going to suffer. All the systems of our society will suffer because of poor health.
And Florida relies heavily on rural communities for its economic activity. So it's extremely important not only to keep our workers, but our communities healthy and safe. Now, I wanted to ask you, you and Anne, because of the long time you've been working on these issues, specifically in rural communities, what policy solutions exist to increase access to healthcare coverage in rural communities?
I'll jump in to start. And this is more of a defensive strategy, and that is, again, looking at the Medicaid program, which, you know, is the largest public insurance program in Florida in the country, and we've got over 4 million recipients in Florida. And unfortunately, even under normal circumstances, Medicaid is often a target for state budget cuts. And there's going to be even more pressures this upcoming session to make cuts in the state budget. We already have one of the leanest Medicaid programs in the country. We need to invest more in our Medicaid program, not less. And again, you know, I think it's worth noting, I'm going to weave in Medicaid expansion again, because with expansion, and we know this from the track record in other states, we could actually save state dollars if we did expansion. And that's because we could be obtaining more federal funding for some of the services that we're paying out of just state funding now. And we would have billions more federal dollars flowing through our state economy and local economies, including rural areas. So expanding our Medicaid program would be a much better solution to filling any budget holes than cutting the program. The other thing I want to mention, telehealth again. I know we've already talked a lot about that. Just want to echo how convenient it is for families, and it's been extremely popular. Recently, the Agency for Healthcare Administration, Medicaid, reported that had a report for the Medical Care Advisory Committee that showed just a phenomenal increase in telemedicine utilization by both the consumers and providers. And just, for example, in just a few months, the number of Medicaid providers using telehealth exploded from 657 to nearly 16,000. So people, even though this may be new for a lot of patients, there's been, it's been very, very popular. And what we need to do right during the pandemic, both the federal and the state government have changed some policies to make it easier for providers to deliver telehealth services. And what we need to do, we need to ensure that those policies that are now in place, both at the federal and the state level, continue so we can facilitate this way of delivering services. It certainly is an important strategy for giving people in rural areas a lot more access to services. And then finally, I would just say we need, and some of the other speakers have talked about this, we definitely need more resources on outreach and enrollment to increase, again, coverage for the uninsured. Unfortunately, in recent years, there's been policy decisions, both at the federal and the state level, to cut back on these investments. These investments are critical for educating families about what health insurance options exist out there. In fact, we know there's thousands of people in Florida that are already eligible for Medicaid, but are not aware of it or need help figuring out how to enroll. So these outreach and enrollment assistance resources are very important, particularly for harder to reach families in rural counties where there may also be lower levels of health literacy. So this is, I mean, finally, I'd say, there's a lot of policy solutions that we already know work. They're not rocket science. We know when we've used them in the past, they've been effective. You just need to have the political will to implement them. And I'll pause there.
Thank you, Anne. Jeff, would you like to say something?
Yeah, I have a few things here. First, I'm going to sort of echo the encore of the encore, and clearly, and maybe I should differentiate my personal feelings versus the organizations I represent, but that would be kind of a weenie thing to do, so I won't. But our refusal to expand Medicaid in Florida, in my mind, borders on the criminal. Early on, when we had these opportunities to do so, there were complaints made by our leaders in the legislature that discussed things like, well, we can't count on the subsidy or the cost sharing to be there for the federal government for so many years, and will it be there forever? Like there's ever a guarantee when they take block grant money or federal road money that money is going to flow forever. So that is just a hollow excuse. I don't know what the current excuse is. As a citizen of Florida, both who's disgusted with the poor health outcomes and the fact that a lot of people aren't covered, I'm also disgusted with the fact that, hey, I'm glad my friends around the country are getting coverage in the Medicaid expansion states, but I'm tired of exporting my federal tax dollars to them for their benefit. I'd like to import some of my federal tax dollars back to me. I don't need a refund. I just want an investment in my Medicaid system in Florida. So I'm all with the concept of the Medicaid expansion. Now, I'll go back to a couple things, one thing I said before too, going back to, and it's not really a health issue, but I think it cuts across all sectors, and it's like a win-win-win, the broadband access. And again, I can't get into all the details here, but if for people who are really into it, look up Washington Post, October 14th, there's a big article about broadband in the mid-Atlantic area, but it has national policy issues. But the point is that broadband obviously will help us achieve the promises of telehealth and get that access that is now burgeoning or on the doorstep of burgeoning based on the stats that Anne just pointed out. But it also allows our rural residents to plug into the knowledge economy and the knowledge economy to plug into them. It also, overcomes so many of the transportation issues. It allows our educational system to work better. I mean, this is a win-win-win across so many sectors. And if you read that article that's in the Washington Post, it's amazing how many bipartisan there are out there right now trying to get things going, but we haven't really kind of all gotten them into one cohesive plan. So we need like a CCC, maybe not the Civilian Conservation Corps, but the Civilian Connection Corps, so we can connect broadband everywhere. Maybe we it's a jobs program. I don't know what, but broadband to me is essential to fulfilling, again, as I said before, the promise in all those sectors, not only health. Now, as a general comment, I don't know if we're making closing comments, but I'm getting the urge to say this. It's kind of like a closing comment. When I was in one of my many permutations in school, I was a language student, studied many languages, etc. And one of the things I'm sure you guys have all been familiar with this, when you're dealing with certain languages and cultures, you'll learn, wow, there's 36 words for that, or there's no words for that in this culture. And you know what? In terms of the uninsured in Florida, in the United States of America, in this day, in this age, with our embarrassment of riches, there should be no word for the uninsured.
That's true, Jeff. Thank you so much for your words. And yes, we are heading into closing statements. Joseph, would you like to add to the comments of your colleagues before?
Yeah. I just wanted to add one thing. I completely agree with Jeff's frustration there, and I share with you and all of that, Jeff. I hope that in the future that we're not just talking about Medicaid expansion. We're talking about healthcare for all, available to everyone. But we're obviously not there yet. One thing I did want to plug really quick, though, that is another solution that in terms of oral health is kind of a new fad that's kind of going across the country is dental therapists. So one of the issues that we have is the availability of providers as well, dental providers in our rural areas. So what dental therapists are essentially is someone that only needs a couple years of school, as opposed to 8 going to dental school, and they come out and they can do essentially around 90 procedures depending on the state regulations for each state. So what that enables us to do, or essentially a clinic like ourselves or any rural health clinic, is you could hire a couple of these dental therapists because they're not near as expensive as your dentist, and you're going to be able to subsidize some of these procedures and serve more people. So there's the backlash, I think, with dental therapists is that it could in turn drive up Medicaid prices eventually. But I think that for now, this is a great solution for something that could help mitigate the problem, even if it's a small amount. So just want to throw that out there.
Thank you, Joseph. Thank you, Joseph. Well, thank you all for being here. I wanted to finish our conversation by asking, how can people get involved with each of your organizations, and what resources are currently available to people? So if each of you can briefly state what your organization is, how can I become involved, and what resources are available. Jeff, you can start first.
Well, thank you, Gabby, and thanks for letting me pontificate and bloviate today. Our organization actually has a board of directors, and our board of directors in our 16 counties are appointed by the county commissions that we serve. So if someone is interested in being on the board of directors and helping WellFlorida shape the policy directions and service directions that it goes into, I encourage them to call us. Go to the website, wellflorida.org. You'll find out what 16 counties we're in, and if you're a resident, or if you work in one of the 16 counties, might live outside, you could have the opportunity to serve on our board of directors. In addition, if you go to our site, in addition to just this sort of policy and research function we do offer a few different health programs as well, HIV and AIDS, a lot of maternal child health. All those are detailed on the program if you're seeking services, especially in those two areas.
Thank you, Jeff. Anne, would you like to share a little bit more about your organization and what resources are available?
Sure. Again, I'm with Florida Policy Institute. We have a website that I encourage you to check out at floridapolicy.org. Medicaid expansion is a priority issue for my organization. I can speak freely about the need to do this. And we're working very much in partnership with Florida Voices for Health, and both our organizations have a lot of resources on our websites that Gabby may talk more about. But the other thing our office looks at quite a bit are budget and tax issues for Florida, which directly impact all these health and human services that need tremendous bolstering in our state. And I encourage you to sign up for our newsletter that talks about policy issues and what you can do to try to make some progress on these issues. If you go to our website, you can sign up for our newsletter. And one final plug, we are leading a coalition of groups around safety net programs here in Florida. We call it the Safety Net Action Coalition. And you send out a monthly newsletter that keeps people hopefully up to date on what's going on with the SNAP formerly food stamp program, TANF, and Medicaid. And if you have an interest in getting that newsletter, or getting involved with the SNAC, we call it SNAC, the SNAC Coalition, please let me know. And Gabby, I assume there'll be some information that goes out as far as contacting us for follow-up.
Absolutely. Thank you so much. And last but not least, Joseph.
Yeah, thank you. So the Rural Health Partnership, as I mentioned at the beginning, is a subsidiary, I suppose. Is that the right word, Jeff, of WellFlorida? So we are, if you want to find out some more information on the RHP for Alachua County, you can go to wellflorida.org. You can just search, I believe if you search rural health, it'll come up, the Rural Health Partnership page. We'll continue to meet and work out solutions and problems. I did want to point out, if you're listening from any one of these counties, we do actively work and on solutions for these counties: Alachua, Bradford, Citrus, Columbia, Dixie, Gilchrist, Hamilton, Hernando, Lafayette, Lake, Levy County, Marion, Putnam, Sumter, Suwannee, and Union County. So the RHP does have a pretty huge spread there, and we are actively working for the community to come up with new solutions and problems solving. So I think, Jeff, am I allowed to give out your email address? You're listed on the website here if you're interested with the RHP. Am I allowed to give that out?
Jeff.
I don't know. Well, anyway, so I'll leave that on. If you're interested, you can go to the WellFlorida website.
Thank you, Joseph. Thank you, Jeff. And thank you, Ann.
I'm having a few technical difficulties. The broadband needs to be expanded here.
That's exactly why we need broadband to be expanded. But I wanted to thank you all for being here today. One more time, this event has been brought to you by Florida Voices for Health in partnership with Rural Health Partnership of North Central Florida, WellFlorida Council, and Florida Policy Institute. Thank you for tuning in, and please remember that Medicaid saves lives. For more information, please visit www.healthcareforfl.org to find out more information on Medicaid expansion. Thank you for tuning us today. We hope you have a good evening. Goodbye.